If you have breast implants, then someday you're going to need to undergo revision surgery. So I tell all my patients, my first time breast implant patients, that if you're going to have breast implants, it means you're going to have more surgeries throughout your lifetime. And if you're in your 20s, 30s, and 40s, then most likely you're going to have multiple more operations throughout your lifetime. Breast implants are not a permanent device, and there are things that can go wrong and reasons why people undergo further surgery. So, if you have breast implants, the studies show approximately a 25 to 35% reoperation rate within the first 10 years. And this is obviously higher than any of us would like it to be, but this is the case. And there are a lot of reasons why you may undergo revision breast implant surgery. Capsular contracture is probably the most common. Capsular contracture is excess scar tissue that builds up around an implant. Now, every breast implant has scar tissue around it. And in the vast majority of cases, that scar tissue is so soft that you may not even know that it's there. But in some cases, the scar tissue can get excessively hard and thick and can contract around a breast implant. That can make it look and feel round, firm, and even painful. And in those cases, we typically go back to surgery to help treat it. So if you have breasts that are really firm, then you may have a capsular contracture that we can improve. Bottoming out is another reason why a lot of women undergo breast revision surgery, and that's when the implants oversettle in the breast tissue can stretch, although you technically may not be droopy. Size change is a common reason that people undergo revision surgery. Sometimes people may change their mind. They want to go a little bigger, they want to go smaller. That's another reason why you can undergo revision breast surgery. Sometimes people develop a ruptured silicone implant or a deflated saline implant. If you keep your breast implants long enough without switching them out, someday they're going to break. And when they do, it is best to switch them out for a new pair. Now, it's not an emergency, so if you have a broken implant, sleep soundly tonight. Okay, it's not an emergency. It's not going to kill you or cause a major disease or breast cancer or anything like that. Although if you do have a rupture or break, it's best to switch it out relatively soon if you can, just because in general it's an easier surgery the quicker you do it, as well as potentially easier on your body. And there are many, many more reasons why women undergo revision breast implant surgery. Now, we cover all of them on this section of the pre-consultation. And so take a peek at take a look at yourself and what your issue may be. It may be my breast implants are too hard. It may be that my breast implants are bottoming out, or they go too far out to the side. And if those are any of your issues, then just take a look at the menu and find what your issue is with your breast implants, and then you should be able to find the corresponding video that will explain the issue and how to treat it. So I hope that will be helpful for you. Now, this is a key. Prior to coming in for a face-to-face consultation, if you are considering revision breast implant surgery, you have to bring all of your records with you from your previous operations. Okay? So call your previous plastic surgeons and ask for a copy of your medical records and bring them with you to your consultation. They will be super helpful for both you and I in the planning of your revision. If you don't have that information, or if your doctor doesn't have it, then call the operative center or the hospital where you had the surgery at and see if they may have a copy. It is so important that you bring it because it can really help us with the planning process. If you don't bring it, if you forget to bring it, then most likely you're going to have to make a second trip to come back and go over that in a second visit. And this would just save you and me both the time and the effort and the hassle of having to schedule two separate appointments when we can hopefully get it all done in one. If, however, your previous doctor does not have the records, if they've purged them, or if the surgical center or the hospital doesn't have it, then at minimum try to bring your implant card. Most plastic surgeons, after you have breast implant surgery, will give you a card that tells you what your implant information is. So try to bring that with you at minimum so that we know the type and the size of implant that you have. I can't emphasize enough how important it is to bring this information with you because it can really help us in the planning phase. And if you don't bring it, it just means you're going to have to reschedule another appointment later on to do that part too. So this is your introduction to revision breast implant surgery. If you need a revision, It's not necessarily a bad thing. In some cases, it's what's expected. That unfortunately is what happens when you have breast implants because they are not lifetime devices. There are a lot of reasons that we may revise your breast implant. Some of them are just cosmetic. You want to change. Other times there may be a complication, and other times they're just getting older. And so, whatever the reason is, I'm happy to see you for a face-to-face consultation to go over what may be in your best interest. We can talk about the surgery. Just make sure you bring all the information that you have from your previous operation. Thank you so much for watching.